Does Medicare spending affect the national economy? Imagine a giant puzzle where each piece represents a part of the economy. Medicare is one of those big pieces, and how much it costs can change the entire picture. In 2020, Medicare spent over $1.1 trillion. That is a huge chunk of the total health care spending in the country. As more people become eligible for Medicare, the costs keep climbing. By the year 2099, Medicare's share of the gross domestic product is expected to grow from about 3.8% to nearly 6.7%. If healthcare costs grow faster, that percentage could be even higher. This means Medicare will take up a larger part of the national resources, which can affect the economy overall. When Medicare spends more, it can influence many parts of the economy. It affects government budgets because more money is needed for healthcare programs. If Medicare costs go up, the government might need to collect more in taxes or borrow more money. This can impact how much money is available for other programs or services. Changes in Medicare spending can also influence private health insurance and how much people pay out of their own pockets. When Medicare reduces its spending, it might shift costs to other areas like Medicaid or cause beneficiaries to pay more themselves. This shifting can change how people spend money and how the economy grows. Medicare pays for hospital stays, doctor visits, and prescription drugs. Nearly 40% of Medicare's money goes to hospitals. Since Medicare covers such a large part of healthcare costs, its spending trends can affect the entire healthcare market. If Medicare spends more on certain services, hospitals and doctors might increase prices or change how they deliver care. This, in turn, influences the broader economy because health services are a big part of what people buy and sell. For people on Medicare, understanding out-of-pocket expenses is important. They pay premiums, deductibles, and copayments. These costs can add up and affect how much money they have left for other needs. When healthcare costs rise, out-of-pocket expenses tend to go up too. Knowing how to calculate and manage these costs helps people plan their finances better. If they understand their expenses, they might decide to use fewer services or look for cheaper options, which can influence overall healthcare demand and spending. So, in the end, Medicare spending does affect the national economy. Its large and growing costs influence government budgets, taxes, private spending, and how much individuals pay. Managing these costs and understanding out-of-pocket expenses are key for both personal finances and the health of the economy. The way Medicare spends money shapes how resources are allocated across the country and impacts economic stability over time.